And it just gets worse. Here is the government's health minister again.
We're also accountable to the British public to fund that pay rise. And what we would be, if we matched, say, to 11%, which is just above inflation right now, that would add about £1,000 to every household in this country.
It's just complete bollocks, completely untrue, and the Prime Minister is shamelessly using the same figure.
What I'm not going to do is ask ordinary families up and down the country to pay an extra £1,000 a year.
And he's shamelessly sending out more hapless ministers every day to repeat it.
If you accept all the inflation level pay rises, that's about £28 billion. It costs every household just short of £1,000.
You've also got to balance that with what is fair for your viewers. And if everyone in the public sector were to receive a pay rise in line with inflation, that would cost an extra £28 billion, an extra £1,000 per household.
There are about 28 million households in the UK, and the Prime Minister is telling the public a real terms pay rise for public sector workers will cost every one of them an extra £1,000.
These are robust numbers. The unions are saying that they want us to match inflation. Inflation is currently between 10 and 11%. If we gave that across the public sector, which essentially is the demand for most public sector unions, indeed for the nurses it's a higher number, that would cost £28 billion. That's £1,000 per household.
It's just economically illiterate and completely untrue. The Prime Minister knows it, and so do all the ministers, now shamelessly repeating it. It assumes all 28 million UK households would make exactly the same contribution in tax, but some households don't pay income tax, and the amount of tax paid varies from household to household, with the best off paying more. And any pay rise for public sector workers will itself be taxable, and that tax is included within the 28 billion, which goes straight back to the government. And then there's this.
If that's the case, then why have the independent number crunchers, the Institute for Fiscal Studies, come up with a figure of £14 billion as being the cost of doing this?
So with all that in mind, listen again.
This is an important point, Laura. If we applied this across the board, that would cost families £1,000 each.
It's absolutely shameful, and that's not the end of it. Here is the health minister again, this time saying it would cost the government £700 million for every 1% pay increase given to nurses.
There's two reasons why we can't. Firstly, we've got to find the money to pay for it, and for every 1% increase, that's £700 million we have to find from somewhere.
The BBC's head of statistics, Robert Cuff, has taken a closer look at this claim and, not surprisingly, says it simply doesn't add up.
It's a government figure, but it applies to a different thing. It applies to a much larger group of people. Okay. So it's if you look at the NHS pay review report, for all non-medical staff, if you gave them 1% pay rise, that would come to about £700 million. But non-medical staff, largely not doctors. So that does include nurses, but it also includes radiographers, physiotherapists, ambulance staff, porters, administrative assistants, managers, senior managers on higher salaries. So once you go out that wide, then you're starting to get to those figures. But it's definitely not a figure that's relevant to discussions of resolving the pay dispute.
Your numbers do not quite stack up. And if you're repeatedly telling the public something that is a bit misleading, how can people trust you?
The government's campaign of misinformation and outright lies continued with this.
The starting salary of a nurse would be £31,000.
It's just a barefaced lie, which the chairman of the Conservative Party couldn't wait to hop over to the next channel to repeat.
The starting salary of a nurse would hit about £31,000.
The figure he's talking about includes extra earnings such as overtime and unsocial hours pay. Basic pay for a newly qualified nurse this year would be about £27,000. The Health Secretary himself has admitted it.
Well, I thought you were going to ask me about nurses, because the first strike we're going to have on is nurses. A nursing starting salary is 25.5, and we're taking it up to 27.
How would you explain to a nurse watching this morning on a starting salary of £27,000 that their contribution to society is worth less than the median salary?
When members of the government have to resort to lying to the public like this, you know they've lost the argument.
I am glad he's raised our nurses, because they do incredible work, and it's worth putting on record. It's worth putting on record what exactly we have done for our nurses. Last year when everyone else in the public sector had a public sector pay freeze, the nurses received a 3% pay rise.
What nurses got after all the sacrifices they made to keep us safe during the pandemic was a crappy real terms pay cut. The simple fact is the government gave nurses a crappy real terms pay cut last year, a crappy real terms pay cut this year. It wants to give them a crappy real terms pay cut next year. And all that's on top of a whole decade of crappy real terms pay cuts. If nothing else, at least they're consistent. Nurses are now using food banks and taking out payday loans to feed their families. Some experienced nurses have seen real terms wage cuts of as much as 20% since 2010. It means they're now effectively working a day a week for free.
And when they asked for nurses' bursaries, we made sure that every nursing student received a £5,000 grant.
This is something else the Prime Minister is now sending out his hapless ministers to repeat.
We gave nurses a £5,000 bursary. That's not reimbursable, so they don't have to pay that back.
The Conservative government scrapped the nurses' bursary, which previously reimbursed their tuition fees. A £5,000 grant goes nowhere near to compensating them for that huge loss. Thanks to the government scrapping the nurses' bursary, nurses now qualify tens of thousands of pounds in debt, and the Prime Minister and his ministers know it. After all our nurses sacrificed to keep us safe during the pandemic, how did it come to this? And now, rapidly running out of excuses, the government's even suggested nurses should drop their request for a fair pay rise to send a message to Vladimir Putin.
You know, a nurse on 20 grand a year, you would think that maybe there were other ways of sending Putin a clear message on Ukraine rather than the fact that you're going to have to have a real terms pay cut.
Is it true that it would cost everybody, every household, £1,000 to give them that pay rise?
Yes, it would if you take. In fact, it would potentially cost more than that.